Hey, good morning, everyone.
Good morning.
So it looks like it's just a couple of us today. I don't know if anyone else is going to join or not, but I'm going to go ahead and get started. So I'm going to talk about hearing today, that hearing chapter, chapter 16. And then I don't know if you guys noticed, but I put some stuff in the discussion board. Um, so you guys can start looking at that and answering those things. So whatever I don't get to talk about like this, I try to do stuff about it in the discussion board so you still at least get something out of it. So hopefully that works out okay. Any questions about anything before I get started?
No.
Okay. If you have a question, just
Right.
stop me. It's no big deal.
Okay.
Okay, so chapter 16, this is on page 314 in your book. So in this chapter, actually both of these two chapters, 16 and 17, this is new material that you guys should not have had anywhere else, and you probably won't get this in any of your other classes, so you really need to pay attention to this stuff good. So in this chapter, we're going to look at age-related changes and risk factors affecting hearing wellness, and also functional consequences associated with hearing in older adults. So let me see if I can share the screen. Let me get on the right thing here too. Here we go. Can you guys see that okay?
Yes.
Okay, so just like in some of the other chapters in this book, on page 315, there's that big chart that talks about age-related changes and functional consequences and risk factors. I definitely would make sure you look at that. On this slide, it talks about how our sounds are coded through intensity and frequency. So sound intensity and frequency may be altered if certain risk factors come into play. So even in the absence of risk factors, though, normal age-related changes affect frequency, causing hearing problems for many older adults. So then the next couple slides, they just kind of talk about the different structures of the ear. So you have the external ear, the middle ear, and the inner ear. So this first one's about the external ear. So the external ear undergoes changes in the size, the shape, the flexibility, and hair growth. And this all increases with age. But these changes don't affect the conduction of sound waves and the hearing of older adults. So generally those types of changes that happen in the external ear don't really affect your hearing. Other things that this mentions, this talks about wax, like ceramin. So ceramin is just this waxy substance. It's a natural substance that's genetically determined to be either dry or wet. The function of it is to cleanse, protect, and lubricate the ear canal. So things that can cause it to build up. So maybe write these down. So the increase in concentration of keratin, the growth of longer, thicker hair, and also thinning and drying of the skin lining in the ear canal. And then one other thing would be, as older adults age, they don't sweat like they normally would. Like they get that diminished sweating ability. So your sweat glands, because they don't work as well, some of that ceramin can accumulate in your ear and be drier and more difficult to remove because you don't get that moisture in your ear. Well, I used to work at an ear, nose, and throat doctor years ago, and oh my gosh, it was crazy the amount of people that would come in to try and get their ears cleaned out, and the stuff that they would pull out of people's ears was just disgusting. It was just like these huge blocks of wax. It was crazy. Okay, so then this gets into the middle ear. So this is where you have the tympanic membrane. This is the transparent pearl gray thing that you would see if you like had one of those otoscopes and you were looking at someone's ear. So you're looking at that pearl gray, slight cone-shaped layer of flexible tissue, which separates the outer and the middle ear. So like when someone gets an ear infection, that's what you'd be looking at. So with increased age, collagenous tissue replaces the elastic tissue, resulting in a thinner and stiffer eardrum. Then this talks about the malleus, the incus, and the stapes. So these are those little bones inside your ear. So these bones are connected to each other, but they move independently, acting as a lever to amplify sound. So their primary function is to transmit vibrations across an air-filled middle ear through an oval window into the fluid-filled inner ear. And this is part of the sound transmission that happens. So that sound transmission depends on the frequency of each sound, and it's best for the middle frequency range of normal voices and less effective for low and high frequency sounds. So age-related calcification of the ossicular bones can interfere with the transfer of sound vibrations. So that means, those bones in your ear, they have some changes that happen to them. So you're going to have a difference in the sound transmission. Your middle ear muscles and ligaments become weaker as well and stiffer with age. So that can also have a detrimental effect on the acoustic reflex. Okay, so the biggest problem when you have someone that has hearing loss is going to be with the inner ear. So the inner ear, they have vibrations that are transmitted to the cochlea. This is where they're converted to impulses and coded for nerve intensity and frequency. So this lists some age-related changes on this slide that affect your hearing, basically. So these are degenerative changes of the cochlea and the inner ear structures that are primary physiologic causes of age-related hearing impairment that affects older adults. So as you can see, loss of hair cells and neurons. You don't have a good blood supply anymore to that area. Degeneration of the spiral ganglion, and all these different things. That's kind of what plays a part with your hearing. Okay, so this also talks about the auditory nervous system. So recent studies indicate that age-related changes in the central auditory structures account for a significant component of hearing loss in older adults, particularly with regard to speech perception. Okay, so then here's some risk factors that can affect hearing wellness. So some modifiable things that you could actually change would be smoking and exposure to noise. So it's funny, smoking affects everything under the sun. I didn't even realize it affected hearing until I was looking at this a little bit more. But yeah, it really does. And then exposure to noise. So if you work somewhere where you're around a big amount of noise all the time, so say you work in a factory or, I don't know, you work at the airport or something like that where you have lots of noise around you, it's going to affect your hearing. So you should always protect your ears with some type of protective gear. Also, medications can affect your hearing. So there's different ototoxic medications. I don't know if you see that in the slide here, but do you guys remember any type of ototoxic meds that you've learned about before?
Mm,
No?
no.
Okay, that's okay. If you don't, that's fine. We're going to go over it here in a minute in a different slide, but so this is talking about the exposure to noise. So noise-induced hearing loss is preventable. So if you do get this, it's because you've had prolonged intermittent exposure to noise. Um, a lot of times, like, people who go to concerts and they don't protect their ears because, how loud concerts are, they can get this type of hearing loss. Also, of course, these are associated with occupational things and recreational activities too. So other things that maybe, I don't know if you've thought about before, that would be associated with this type of hearing loss. So if I'm a farmer, farmers are around a lot of equipment that's pretty loud. So that could be, a reason they would have it. Construction workers, musicians, people who work in bars, how loud bars are. Um, any type of people who work in like an industry where there's a lot of noise. Also hunting and target shooting and motorcycles, power tools, just doing anything like that, that would, make you be around loud noises too. This talks about exposure to toxic chemicals. So, metals, solvents, or pesticides, anything like that, that could put you at risk for hearing loss. And then we already talked about, the impacted wax. So believe it or not, like working in the ear, nose, and throat doctor's office, I would see this all the time. Like the majority of the people that would come in would be this type of patient. They just come in to get their ears cleaned out because they can't hear. So this is the leading cause of hearing loss. 57% of older adults have hearing loss, and it's just because they have impacted cerumen in their ears. So again, this is really preventable and treatable. So, as long as you clean your ears out really good, usually it's better after a shower because you have that wetness in your ears then, and then you can get all that wax out a little easier. Also, the use of hearing aids is a big thing because when people have hearing aids in and they have a lot of wax, then that can like block everything up as well and impact the cerumen even more. Okay, so here's a list of some of the things that can be ototoxic. So aminoglycoside antibiotics. So this would be things like gentamicin and neomycin. There's a bunch of other ones, but those are the ones I have written down. Aspirin would be an ototoxic med. Loop diuretics. Quinine, which I don't know if you have talked about that or not, but quinine is supposed to be for malaria. So other contributing factors that commonly occur in older adults and increase the risk for ototoxicity would be renal failure. So, hey, I'm taking a medication and because my kidneys don't work as well anymore, I can't excrete that medication very quickly out of my system. So it may cause me to have ototoxicity. Other things might be, older adults take a lot of different types of medications all at the same time. So sometimes medications will interact with each other and then, they can cause ototoxicity that way. There's a bunch of different disease processes that will affect your hearing. So I just want to mention a few of those here on this slide. So otosclerosis. So this can cause conductive hearing loss. This is a hereditary disease, and it has to do with those auditory ossicles, those little bones in your ear. So it usually begins in youth or early adulthood. Hearing loss may not be detected until like middle age or later adulthood. When age-related changes compound the disease, initially it's difficult to hear soft and low-pitched sounds, but then as hearing loss worsens, the person is likely to develop dizziness, tinnitus, and balance problems. Mercedes, do you know what tinnitus is?
No, can you explain that?
Tinnitus is just ringing in the ears.
Okay.
Okay, so that's autosclerosis. So it's, again, it's just a hereditary disease, and then you don't really see symptoms of it until you get a little bit older, and you get that ringing in the ears, the dizziness, and the balance problems as a result. And it's conductive hearing loss. So then another one they mention here is Meniere's disease. So this is an inner ear condition. So this can cause things like vertigo, which if you have vertigo, it feels like everything is spinning all of the time. Like if you, I don't know if you've ever had that happen to you where maybe you get up in the morning or something and you feel like the room is spinning or something. This person has that all the time. And then they can have tinnitus as well, so ringing in the ears, and then also hearing loss that comes and goes. So other things that they might feel with this would be like they feel a fullness or pressure in their ear, and usually it's just one ear that's affected and not both. So hearing loss can eventually be permanent with Meniere's disease. Then there's something called acoustic neuromas. So this is just a tumor, basically. It's a non-cancerous, slow-growing tumor that develops on the vestibular nerve. So this is a nerve that leads from your inner ear to the brain. This nerve, it influences balance and hearing. So you're going to have issues with both if you have this type of tumor. So typically they'll go in and do surgery and remove the tumor, and that would fix your problem.
Okay.
So they mentioned quite a few other things here. So, you know, they have diabetes and cerebrovascular disorders, hypothyroidism, all these different things, even viral infections. So have you guys known anyone that has had any kind of viral infection that has affected their hearing?
Mm, no, not that I know of.
I actually have a friend of mine that I went to college with that she had this happen to her. She just had this viral infection that she couldn't get rid of, and it affected her hearing, and now she has to wear a hearing aid, all because she had a viral infection. Isn't that crazy?
Yeah. Wow.
And she's young, so. Okay, keep going here. All right, which is the most prevalent risk factor for impaired hearing? That's going to be exposure to noise. Okay, so this gets into functional consequences that affect hearing wellness. So this is where it starts talking about the different types of hearing loss. And this is, again, is a really important slide. You need to know this because you won't get this in any other class. So studies have found that the female gender, Black race, and darker skin in Hispanics decreases the risk for hearing loss. Because hearing loss in men begins at an earlier age and declines more rapidly, the cumulative effects are usually noticed by men in their 50s and by women in their 60s. So here's the difference between these different types of hearing loss. So conductive hearing loss is abnormalities of external and middle ear interfering with sound conduction. So anything like from the outer ear to your middle ear, anything that happens there that is affecting how things are conducted. So like with wax would be a problem here, and you would have conductive hearing loss from wax. Or maybe like you have a ton of ear infections or something. You know, when you get an ear infection, that's that eardrum right there, which, you know, is right there between the middle ear and the inner ear. So maybe that's part of your problem. So sensory neural hearing loss is abnormalities of sensory and neural structures of the inner ear. So this is more of an inner ear issue. So usually age-related or noise-induced. And then mixed hearing loss is a mixture of both of those two things. Okay, so this starts talking about effects of communication. So there's something called, I can't even say it, presbycusis. This is just basically sensory neural hearing loss, so problems with your inner ear. So when you have this, you have a diminished ability to hear high-pitched sounds, especially in the presence of background noise. So this is associated with age-related degeneration of your auditory structures. So, you know how we said that there's some changes that happen in those bones in your inner ear.
Mm-hmm.
Usually if you would have this, it's going to occur in both ears. And you just have that diminished speech discrimination. So this would be the person that you talk to who constantly is watching your lips as you talk because they can't hear really well. So if they watch your lips, maybe they can pick up what you're trying to say. And then this mentions predisposition to impacted cerumen. Of course, you know, older adults are going to have that. And then psychosocial consequences. So yeah, if you can't hear anything, it would be really depressing because you feel like you're missing the conversation. You miss what's going on with everyone. You would feel very isolated socially because you wouldn't be able to contribute to the conversation because you can't follow what's going on. It can lead to a decline in cognitive function and also a diminished quality of life. And then here's where it mentions that tinnitus a little bit. So again, this is a sensation of ringing, roaring, or blowing, or buzzing sound in your ear. Or other types of noise that don't originate in the external environment. So if you just feel like you have some type of noise that's constantly in your ears, that's what tinnitus is. So this is a symptom usually of something else going on. So typically you don't just have tinnitus. Usually it's a symptom of something more. So it is a lot of times associated with hearing loss, ototoxic medications, and Meniere's disease. And you can exacerbate this. So if you have this, it would be really annoying to constantly hear that in your ears. So if you drink lots of caffeine, alcohol, or have nicotine, that can affect this. So you would want to try and stay away from those. So there are two risk factors associated with tinnitus. So they would be increased age and also increased exposure to noise. Which statement about tinnitus is true? It's going to be C. People with tinnitus should be evaluated for associated other conditions to see if maybe there's something further going on. Okay, so then when we're doing assessment with people for their hearing, we want to look inside their ears with that otoscope to see what's going on. So you would be able to see that eardrum to see if it looks pearly gray like it should, or if it looks like it's bulging, like someone has a lot of fluid in their ear, if it looks red, you would be able to see all of that. You would also do the tuning fork test to test their hearing. I don't know, did you guys do that in lab yet?
We just went over like the different ways, but we didn't do like the tuning fork. But we did the otoscope.
Okay. So in our actual lab, we have two different tuning forks. And like if you hit it on the table and then like the one you just set on the top of this person's head and you feel the vibration and you can hear the sound from it. So that would be one way to test. And then the other way is to hit it and then put it like kind of by their ear. And then you want to see when they don't hear that sound anymore. So those are the two different ways. Of course, there's all these different screening tools that we always talk about in this class. So they have a hearing handicap inventory for the elderly that you could do just to see, you know, how that goes. You could talk to them about family history, risk factors, their attitudes about hearing aids. If they do have a hearing impairment, a lot of people are real funny about wanting to get hearing aids. To me, I know I kind of would see the point in that. I would see maybe I wouldn't want to have people looking at me funny because I have a hearing aid in. But
Mhm.
I think it would be beneficial because you would miss so much if you didn't have that in, you know?
Yeah.
Um, so those would be some of the things we'd be looking at. So other stuff, we want to identify factors that interfere with hearing wellness. So we want to see if there's any opportunities for improving their hearing and see if there's any barriers to implementing interventions. So common barriers to using hearing aids, this is what people say according to our book. So it's a perception that hearing aids are often um, expensive, you know, so concerns about the cost. Difficulty arranging for an evaluation. So sometimes people have a hard time getting into someone to get evaluated for their hearing. Lack of transportation to appointments. And I think that's a big thing with a lot of older adults. They have a hard time getting there. Embarrassment about visibility of hearing aids, which that is kind of different over time because years ago, when people would wear hearing aids, they'd be like these humongous things around your ears. But now they're very tiny and they can go just in that hole, so you really don't notice them very much. Lack of manual dexterity necessary for the use of smaller hearing aids. So a lot of times older adults have a really hard time like messing with them, you know, because they don't have that good dexterity in their fingers. Okay, so here's some nursing diagnoses that could apply here. So readiness for enhanced communication, sure. Um, maybe anxiety about, you know, just the whole process of getting a hearing aid or something. Impaired social interaction, risk for loneliness, ineffective coping, any of those things could work. Okay, so then this talks about some goals that you might have for people. So maybe you would want to make sure that they had better communication with others, or that they're interacting with people more, or they're interacting safely and functioning well with their new hearing aid or something. Any of those things would work. And then here's some interventions that we need to talk about. So of course we want to promote hearing wellness. So some interventions for hearing loss would be sound amplification, surgical interventions, and also auditory rehab. So what would be something that would be a sound amplification? What do you think?
Mhm.
So we have all kinds of different things out there that help people that have a hard time hearing, right? So like, for instance, this isn't really sound amplification, but like, you know, when someone can't hear, they have the closed captioning on the TV for them. So you could turn that on so they could at least read what's going on and still, you know what they're seeing. They have certain things for the phones now where they have that closed captioning for the phone. So even if they can't hear you talking very well, they can still read it on their phone. Um,
Could it be like microphone on your phone,
sure,
like explain to you?
sure. And then like, you know how there's a lot of things that will read to you? You know how the computer will do that now? Where like say
Mhm.
you have an ebook and you don't feel like reading it, so you just hit the button for it to read it to you. You know,
Yeah.
there's stuff like that too. So different ways that you can do sound amplification would be through hearing aids, of course, those closed captioning devices, and then megaphones or microphones. So have you ever seen a movie where they have those humongous like things that they'll stick in their ear and they'll go, hey, hey, I can't hear you, you know? And you have to
Yeah.
talk into that big megaphone thing. So that would be just a way to amplify that sound. And then auditory rehab. I don't know if you've ever even heard of that, but This is just going to refer to services that improve communication for people who are hearing impaired. So they provide counseling, amplification aids, communication methods, and management of the environment. And then with surgery, like say I had an issue with the bones in my inner ear, they may be able to do surgery on that to fix that. And then there's something called a cochlear implant that sometimes they'll be able to do to help with that as well. So I have a thing that just popped up that says I have 10 minutes, so this will cut me off here shortly. So anyway, those are the big things to look at on this slide. Okay, so then when we are evaluating effectiveness of nursing interventions, of course, you know, we just look at whatever our goal is. So if our thing was, hey, we wanted to improve communication, did that happen? Are they able to communicate with people better because they can hear better now? Use of appropriate amplification aids. So maybe we got them hooked up with a hearing aid and now it's working well for them. And then increased participation in social activities. Sure, you know, we would want to see if that was happening. Okay, which letters of the alphabet become distorted as hearing progresses, or hearing loss progresses? It is going to be B. So B, D, K, P, and T, because these are high-pitched sounds. What do studies of the psychosocial consequences of hearing impairments demonstrate? So this is going to be A. Hearing loss is less likely to have detrimental effects for people who have few social relationships. Then, which is not a contraindication for clearing the impacted ear canal of cerumen? So this is going to be D. Chronic disease of the respiratory system.
Okay.
So again, you know, if you're trying to evaluate the effectiveness of an intervention, you just want to see that they are doing well. So they're able to communicate, they're participating in activities, and they're able to use their hearing aid appropriately. So one of the things, let me see if I can stop sharing this for a second. One of the things on our test that it asked about hearing specifically is how to take care of a hearing aid. So what do you think would be some important things that you would need to know about that? Have you ever had to deal with a hearing aid before? Do you know anyone that has a hearing aid?
No, but the nursing home, a person had a hearing aid, and it's like a certain way you have to like push it in all the way so they won't fall out. I mean, but
So on page 329 in your book, there's a big box. It's box 16-8. Right towards the bottom of that box, it says guidelines for care of hearing aids. So this is some of the things that it talks about. So it says keep a fresh battery available, but do not purchase batteries more than 1 month in advance. So always have extra batteries, but you don't want to have them like, you know, too far in advance because the battery will go bad. You want to turn off the hearing aid before changing the battery. Remove the battery or turn off the aid when not in use. Clean the aid weekly using warm soapy water for the ear mold and a toothpick or pipe cleaner for the canal. Never use alcohol on the ear mold because this will dry and crack it. Avoid extreme heat, cold, or moisture. Avoid exposure to chemicals like hairspray or anything like that. And then avoid dropping the aid on a hard surface when handling it because, you know, you can damage it that way. So those would be some things to know for that.
they should have come out with like a charger for to charge it like they do with like the AirPods. They should do that.
Yeah, that would be a good idea. See, you could probably make a ton of money by coming up with that, right? Another thing that I think our book mentions that we have something about on the test would be techniques for communicating with hearing impaired people. So this is another box on page 330, so box 16-9. So again, you know, if someone has hearing loss, a lot of times we think we have to talk super loud to everyone, or I don't know, just like the tone of your voice doesn't necessarily have to be super loud for someone to be able to understand what you're saying. So I would take a look at that box as well. So out of this chapter, just make sure you know the difference between the different types of hearing loss, the conductive, the sensorineural, and the mixed. And then a couple of those things that I just told you about. And then just the stuff about the wax in the ears, that's a really big thing in this chapter. So that's the gist of this one. The other stuff with the eye, there's a ton of information about the different eye disorders on the next test as well. So make sure you really look at all of those different eye disorders really well. If you have questions, just ask me. It's not a big deal. I'll help you out as best I can. I will try to comment on the discussion board to the way people answer things too, so that we can all kind of get something out of that. And then I think we basically just have next week where we have more topics to go over, and then you have a test. So, and I gave you guys the test tips to review from last night. Did you guys see that in your email?
Yes.
Okay, good. And I plan on doing that for Intro to Clinical Nursing as well. I didn't have enough time last night, so I'll see if I can do that today.
Okay.
Okay.
Okie dokie.
All right, if you guys have specific questions about anything, you can always go to the chat box in Canvas and just type something, and I'll keep looking at it throughout the day to see if there's anything you need to know from me.
Okay.
Okay? All right, thanks you guys for coming. Have a good weekend.
You too. Thank you.
Thanks.
Bye-bye.